Good morning, everyone. I'm Megan Cupp, along here with Scott Micklin.
Good morning. It's Monday. It's really a Monday.
That's why there was that delay.
We've had a little bit of a delay getting
but
on the
everybody's
air.
been waiting for what comes after the drum solo.
That's right.
So.
But here we are. Now we've heard a little bit more of the music. It's Monday, September 21st, week number
28.
Really? Mm-hmm. You're sure?
It could be 29.
No.
Okay, so you know it's not 29.
I think it's...
So it's totally 28.
I'm going to go with you.
By process
week 28.
of elimination.
It's because 27...
Was last week.
And we know we've been to 26. I don't, yeah.
It's 28.
28.
We're going to have one of our faithful listeners post
They will
it
tell
soon.
us, and we will appreciate that because they're paying more attention than we are. But we're here, so that's a good thing.
Yeah.
So we're already, heading...
Isn't that the first rule of public speaking is to, not divulge when you mess up?
I didn't divulge anything.
Okay. I can neither confirm nor
just here on
deny.
the show. We're just starting the show, But yeah.
Are we going to look at numbers?
Yes.
Do that?
We should do that.
Yes. So Johns Hopkins University dashboard, my faves. U.S. confirmed cases, 6,813,984. U.S. confirmed deaths, 199,525. And we were just commenting before the show started that there's that big 200,000 number that people have been perseverating on, I would say. But thankfully, we're still 500,000 away or so from that. But, it's notable.
Well, and you've been talking a little bit about that prediction that we could have gotten there at Labor Day. And here we are several weeks after Labor Day, so I think that's a positive, I guess, that we've haven't hit that horrible milestone as early as maybe folks were projecting that we were going to hit it. Mm-hmm. We're going to hit it. Unfortunately, I don't think there's any way to avoid the 200,000 deaths, but the fact that we've kind of lengthened that time is maybe positive.
Yeah. So. I mean, I think I think there's two really notable things going on. One is there's also collateral deaths from coronavirus. If you think about, we've heard a lot of reports of people delaying treatment, for example. Maybe they feel sick, maybe they feel early signs of heart attack, but they're afraid to go in because of the virus, or they're delaying these preventative testing things that are advisable for certain risk groups and age groups and such, and then of course the deaths of despair. So we can confirm certain deaths of they died of COVID-19, but there's also this whole swath of other deaths that are sort of secondarily related, if that makes sense.
Right.
And then the other thing that's notable is the United States only has 4% of the world's population, but it has 21% of the world's cases and deaths.
Right. That's true. So we do have our first guest who is on the phone, and our phone is a little unique this week. Jeff Bourgeois has called in from San Juan Regional Medical Center, and Mr. Bourgeois, it's great to have you on the show. As always, thank you for calling in.
Hey, my pleasure. Good morning, Scott and Megan. How are you all today?
Doing well, thank you.
We are good. Thank you very much. Thanks for calling in. Good. And can you give us a little bit of an update, if you would mind, from San Juan Regional Medical Center, and let us know kind of how things are looking there at the hospital?
Yeah. Well, this is getting kind of boring for you all, Scott. Not much has changed, really.
That's good. We love that.
We
kind
love
of an
boring.
update, though, Jeff Bourgeois.
We only have 2 confirmed positive COVID patients in-house today. None of those are intubated. And just looking at some of the state statistics, since Friday, there's only been a total of 17 positive cases reported from San Juan County since Friday.
Right.
So, a pretty consistently low level has maintained over the past several weeks. We currently have an overall census of 116. Proud to say we have 7 healthy, normal newborns in our nursery this morning, and as far as the hospital is concerned, life goes on. We I think mentioned last week, perhaps we have our community flu shots that will be a little different this year because of all the social distancing requirements. But on the 24th and 31st of October, we'll have a couple of drive-through flu shot clinic opportunities in collaboration with the Department of Health and San Juan College. So more details about the exact time and where to go for those will be coming here in the upcoming weeks. But
okay,
a little different spin on the flu shot drive this year.
right. Well, but that's good to know, and I know Megan has already told us that that's what tells her it's fall when she gets her flu shot.
It's true. And do you guys hand out lollipops like we used to when we were kids?
Yeah, maybe that or some striped candied gum. I don't know.
I feel like
There
that
you
would
go.
encourage people to. I feel like I'm always, like we said, into the flu shots, but
Sure.
I think there's like a lot of like public reticence sometimes when it comes to flu shot. I hope that this year will change their minds as
Right.
we've been waiting for bated breath for a coronavirus vaccine. Maybe
That's right. But since this is at the end of October, we could start the debate about candy corn, too.
Ooh.
Maybe that could be something. I know people either love it or hate it.
I think you can buy that in bulk, Mr. Bourgeois. So that might be an
That's right.
option.
There you are. Well, Jeff Bourgeois, we always appreciate your update, of course, and very glad that it's kind of almost like a broken record, and kids ask your grandparents what a record is, of what we're talking about. But I mean, it's so great to hear these numbers that are, obviously manageable and controllable, and it sounds like we're doing a pretty good job here in San Juan County with controlling these numbers even after Labor Day, which I think I was a little concerned about seeing a spike, but we haven't seen it yet, and knock on wood, we're not going to see it.
We haven't seen it yet. In the information that the state puts out every week, statewide, this statistic that they looked at that is looked at is called the R effective rate. It's a measure of the growth rate. So you want to be below 1. Statewide, we're at 0.9, which is good. And this is as of last Tuesday. And San Juan County improved from 0.9 the week prior to 0.7 last week. So that was really encouraging as well.
No kidding. Well, again, go San Juan County, and even the numbers in the state, as you mentioned, are lower. So we appreciate that. Megan, anything else to ask Mr. Bourgeois this morning before we let him get on with his day?
I feel good. I'm going to be counting down until October for that shot.
Okay, you've made her day.
All right. We'll be waiting for you, Megan.
Thank you.
There you go.
All right.
Thanks for calling in this morning, Jeff Bourgeois. We appreciate it very much.
Thank you guys as well. Bye-bye.
All right, bye now. That is Jeff Bourgeois. He is the President and CEO of San Juan Regional Medical Center calling in this morning. We appreciate that, of course, very, very much. So there you go.
This conversation about candy in October reminded me of the governor did have a press conference on Thursday, right?
Yes, she did.
And so those slides, I always like to look at the slides they produce, and I learned that there was a completely new phrase to me. You ready for this?
Okay.
So there was a bullet point about how you can go to the pumpkin patch this year, that is apparently allowed.
Yes,
but
right.
My favorite was there was like a follow-up, like a little parenthetical thing that was, it said, and we will be updating other autumn activities operators.
COVID-safe practices.
Autumn activities operators. Have you ever heard that phrase?
No.
Yeah.
Hearing it now.
Probably a hard pass on the apple bobbers.
I
would think.
I think so.
I think that's
this year,
that's wise.
Yeah,
this
I
year.
Think so. Confirmation. Week 28.
On faithful wall calendar.
Maybe we should hang one up in here.
I feel like we should have. Why don't we have a calendar? We don't have
here.
any of the cool stuff that other newsrooms have. Where are our world clocks?
Right.
And I just have this rug.
Right.
Replace it with a calendar.
It's beautiful, though.
Yeah.
It's beautiful.
Sorry.
It is.
Apologies to the
there you
rug.
go. But we have time and we have temperature.
That's good.
What more do you want? Come on.
That's all we need. Bare bones in this studio.
There you are.
Can't even work a phone.
Not today.
Not today.
Phones are an option
So
today.
anyway, so maybe we can go to the pumpkin patch, then get a flu shot. That's a day.
There you go.
That's a full day.
You're
right there.
already planning. I like it.
Yeah.
Okay. All right. There you go. Nice. We do have another guest
Yeah.
on the program today, but let's back up just a bit because we talked about the Johns Hopkins numbers.
Yes, we did.
Which I know you always like to talk about. We did talk about the testing schedule this week, which I do always like to pass along on Mondays to show folks what's going on. So these look like mostly evening testing here, just this evening, Monday, September 21st, 6 to 7 p.m. at San Juan College. Tomorrow, September 22nd, 6 to 7 p.m. here at San Juan College. Thursday, September 24th, 6 to 7 p.m. here
At San Juan College.
say it with me. And Friday, September 25th.
Here at San Juan College.
In the morning.
In the morning.
7 a.m. to 9 a.m. here at San Juan College. And then on Saturday at the San Juan County Public Health Office on South Miller, 8 a.m. to 9 a.m. Saturday morning.
Very good.
So a little bit of variety. And I think, again, the reason our numbers are down is because I think we're doing a really good job of testing and tracking and finding out where these outbreaks are, if someone's positive, and stopping the spread. And so we're not seeing a lot of extra cases, which is terrific. So, in my very non-medical opinion. But that's
but highly internet curated opinion.
Yes.
We've
learned a thing or two from sitting here for the last 28 weeks.
We have.
Right.
We have our finger on the pulse. Thanks to the docs.
Yes, definitely appreciate that. Again, the Johns Hopkins numbers that we passed along earlier, and then I want to get to the state numbers, as Jeff Bourgeois was talking about. So again, there were 67 new cases reported yesterday. One of those was in San Juan County. 2 additional deaths across the entire state, so we're almost at 849 deaths. We are there. None of those in San Juan County, so we're still at 197 deaths locally here. And then our recoveries up by another 70 for 15,412 recoveries.
Very good.
Across our state. So that's how things are looking.
Those are positive numbers. Those are good.
Right? For the whole state. I think that's, again, anything we can get under 100, that's wonderful. And then the news stories from the Navajo Nation, this is what I want to share too. Again, 12 new cases across the reservation yesterday. No additional deaths on the Navajo Nation, so they're now at 10,119 cases. 0 deaths at 548 deaths across the reservations now. And again, 7,232 recoveries on the Navajo Nation.
Very good.
I was to pass that along as well.
Yes.
So there you are. That's the latest information there. So, our next guest?
Yeah, let's do it.
We
pre-recorded this one.
We did. This is kind of interesting because you had to go to an undisclosed location. And so we've kind of sent you out there.
In the field.
Yeah. And
but it wasn't a literal field.
So since it's pre-recorded, we won't try to make believe that it's live and you're running out the door right now to go into this
purple
bunker
room.
Yeah.
That looks like a bunker.
To do the interview. But there you go. But anyway, this is Justin Crossy. He is the regional administrator with the Small Business Administration who was in Farmington last week. So let's hear from him because we know small businesses are suffering and facing these challenges during COVID-19. Here we go, everybody. Megan has been sent to an undisclosed location for our next interview. There she is. Good morning.
Good morning.
There she is. And joining us now to talk a little bit about the Small Business Administration, Justin Crossy is joining us on the phone this morning. He is the regional administrator with the Small Business Administration. Mr. Crossy, good morning.
Good morning. How are you all today?
Very well, thank you, and thank you for joining us. We appreciate you being on the line. You were in Farmington last week as for a visit, and so maybe can you start by talking to us a little bit about what brought you to town? Why were you here?
So I have been touring Region 6, which is Louisiana, Arkansas, Texas, Oklahoma, and New Mexico for the last 3 weeks, visiting with small businesses that have utilized the Paycheck Protection Program and finding out firsthand from those businesses how that program helped them and what we as SBA can do to further assist them as they move forward in this new business environment.
Gotcha. And so what did you learn when you were here, Mr. Crossy? Were you getting some good messages from businesses? I think that program has been widely well received.
Yeah, absolutely. Everywhere I have gone across Region 6, to include New Mexico, the message that I'm getting from small business owners is that if it were not for the lifeline of the Paycheck Protection Program, many of those small businesses really don't know what they would have done, and many of them would have been forced to close their doors. So with the bold steps taken by the President by signing the Paycheck Protection, the CARES Act into law, extended a safety net to those small businesses so they could weather this pandemic.
Right. And I know Megan has a question for you. I just wanted to point out in your region that you talked about, right, in Arkansas, Louisiana, New Mexico, Oklahoma, and Texas, there are about, 3.8 million small businesses?
That sounds about right. I can tell you that the businesses that I'm meeting with are of all walks of makeup. And
Got it.
while I can't give you the exact number, they certainly are the majority of the businesses in the area, the job providers in the areas that I've been going to.
Okay, very good. Megan?
Yeah, so as these restrictions continue, I want to know if there are plans to continue funding. I know that this thing is dragging on for as long as basically the virus decides, and so
This thing being COVID, you mean this thing?
Being COVID,
Yes.
right? Of course, the virus of 2020, and so I just want to know: are there plans to provide more assistance as we go on? What's going on there?
Well, so on August 8th, the Paycheck Protection Program ran out of the authorized time that Congress had authorized the program for. There was still funds available in that program. Currently, Congress is looking at different options. And while I can't speak to what Congress may or may not do, what I can speak to is what the Small Business Administration can do. We are committed to helping small businesses be successful. That was our mission prior to COVID, and it remains our mission in this post-COVID world that we find ourselves in now. And so while I can't speak to what Congress may or may not do with regards to another round or another version of the Paycheck Protection Program, I can absolutely speak to what the Small Business Administration can do, and that is a resource for small businesses to plot a course forward and how to remain successful.
Very good.
I'm sorry, Scott.
No, go ahead.
We don't have, we're not in person enough to coordinate this. So what does that support look like aside from finances? How do you support small businesses?
So the Small Business Administration, if you think of us like a toolbox, and if you come and you being a small business comes to the Small Business Administration for assistance, we have all kinds of different tools that are available in that toolbox. We have the Small Business Development Center, who I visited with while I was in visiting New Mexico, and they are a resource that's available to small businesses to come in, to sit down, to get counseling, to look for unique ways in which they can continue to provide the services to their customers, and how do they do that effectively in this new environment. We also have SCORE mentors available for small businesses to speak with, and these are typically people that are already in business, successful within the community. They volunteer their time to offer assistance to new businesses or existing businesses and help them chart a new path forward as far as what does my business plan look like? Where do I need to tweak things? The one thing that I've noticed is a common thread amongst all the businesses that I have met with in Region 6 is that they want to get back to work. They want to be able to open their doors, and they want to be able to provide the services that they were providing prior to COVID. They want to get back to work, and what they need is an opportunity to do that. The American entrepreneur is not the type of individual that's going to sit back and just kind of wait for somebody else to say, okay, now you can go and do this. I mean, let's be honest, they started their own businesses. They understand that there's a certain amount of risk involved in anything that you do in life, and they want to get back to business. They want to do it in a safe way so that their customers and clients feel safe participating in whatever that service may be. And again, they want to get back to business.
Very good. And Mr. Crossley, I wanted to ask you too, I guess if you were asked for a recommendation from Congress, would you recommend that they come up with another Paycheck Protection Program or reauthorize it with some more money from these businesses, from the folks you've been talking with?
Well, what I can do is, while I don't make recommendations to Congress, what I can tell you is that the businesses that I have met with have repeatedly told me that the Paycheck Protection Program was the difference between having to close their doors and being able to remain open. And so I would say that the program has been a huge success, and that there is probably a need for that moving forward.
Understood. And then other advice maybe for businesses during this time, again, as they kind of navigate what's going on. I know each state, of course, is different with their public health orders and things like that. But from your perspective with the Small Business Administration, do you have any other advice for businesses during this time?
The best piece of advice that I could offer to a small business right now is to reach out to the Small Business Administration. You can go to our website, which is sba.gov, and from there you can navigate towards the offices that are in your area. And again, we have offices in every single state. The New Mexico district offices in Albuquerque. They can find that information at sba.gov. In addition to the SBA offices there, we have the Small Business Development Center, we have Women Business Centers, we have Veteran Business Opportunity Centers. So we have tools available for all entrepreneurs, and the resources that the Small Business Administration provides, the counseling, the training is all free. I would just encourage any small business that has questions to reach out to us. Let us find the appropriate resource for you, put you in touch with them, and help you move forward. Again, it's what is clearly a challenging economic environment, but we are here as a resource to help small businesses be successful. Again, it's been our mission prior to COVID, and it will remain our mission moving forward.
Yeah, that's great. And of course, we all appreciate all of the work the Small Business Administration is doing. And thank you so much, Mr. Crossi, for your time.
I greatly appreciate the opportunity to speak with you.
Great. Thank you very much. Appreciate it. That's Justin Crossi. He is the Regional Administrator for the Small Business Administration speaking to us this morning on KSJE. Thank you, Megan. Now you need to get back to the studio. Okay.
I know.
All right.
I'll head over there real quick.
Please do.
Do you like the cinder blocks? It's pretty classy back here.
Nice. Very nice. And we're back. See, how about that?
I'm wearing the same blouse, which was not intentional. But
wow. Okay. But
I washed it.
Thank you. Okay, thanks. You didn't have to. Okay. You just made it awkward. Okay.
I mean, I don't know. I would have been thinking that, like, ooh, did they wash that shirt? Anyway.
Yeah. Very informative.
Yes.
From Justin Crossi, and I appreciate that. Again, the Small Business Administration and the Small Business Development Center here at San Juan College. We talked to Carmen Martinez numerous times about all the things that she has been able to do and her staff to help local small businesses. So we definitely still encourage folks, if they're still trying to figure this out, and who isn't, to give her a call and see how they can help, because I think there's still opportunities available. So there you go. You had a couple of stories to share.
I do.
About COVID that you've been, I know, because you research all weekend, and I appreciate that.
Sort of.
Yeah.
I mean, I definitely research more than you.
All right.
That's not really a dig. That's like our roles, you know?
I understand. Yeah.
You procure the guests, you work the board, I do the research.
Okay.
So, yes.
Good save.
Thank you.
Good save.
I didn't want our viewers and listeners to think I'm like taking pot shots at my lovely co-host here. We have mutual respect here.
Now you're just
over
the top. But anyway,
okay.
What'd you find out? What'd you find out?
Kenya. So Nairobi.
I can. Can you? Oh, Kenya, the country.
Kenya, the country.
Thank you.
So obviously there was a lot of fear. How is this going to impact sub-Saharan Africa? Which is a fair fear, because usually these types of things do disproportionately affect poor countries, and poverty is endemic over there, and
not a big medical infrastructure, right? In
not a big
countries.
Period. Not just no infrastructure, really. So anyway, but they have successfully weathered the storm and had 700 deaths so far, which is,
for the whole country,
right? Which is significantly smaller than, say, our death toll. And so they've been trying to muddle through, well, what's that about? Now, the Johns Hopkins mappers do caution because these blood, they're using blood tests, antibody tests to track it, and that data is a couple of months old, outdated by now. But they do think that, it's trustworthy data that they're receiving, even if it's maybe incomplete. But there's no reason to suspect that those numbers are being fudged with. They think that they really are weathering this better, and they can't really discern why. So, it's clear that they're following public health orders that all of us are following, but also, why does it seem like this group of people, this ethnicity, is faring better? And there's two theories on that. One is it's a country with a young population in general. It's just a younger demographic.
Okay.
And the other suggestion
so healthier, I guess? Is that what they're thinking?
Well, younger people...
They don't have these underlying health conditions?
They're less likely... Well, younger
do?
People just recover better, period, of all illnesses and injuries and stuff. And so that's one suspicion. The other one is that these countries are much more acquainted with other types of coronaviruses. If you remember early on when Dr. Philpott told us about the MERS, she went into all the detail about the MERS coronavirus, which was the most recent one, which was hitting that area of the world, not our area of the world. And so there's some suspicion that maybe there was like a crossover immunity effect.
Interesting.
Fascinating.
Yeah. Okay. Well, good for them. So they're doing much better.
They are doing
a lot of other countries, even other countries in Africa, I think, too, right?
Yeah.
So...
shout out to Kenya.
There you go.
Thanks, whatever you're doing, guys. And then the other story was about vaccines, but not about the coronavirus vaccine, but about other vaccines that we usually give to children, right? So measles, mumps, rubella is a big one, and stuff like that, or varicella maybe if you didn't have the chickenpox yourself before that. So basically there is evidence to suggest that these children and infants are actually getting less of those vaccines. One leading theory is, again, people are reticent to bring their children in for routine stuff because of this virus going on. But the other complicating factor is that a lot of airplanes have been grounded. Right. So the other complicating factor is getting vaccines to these locations because that system has been disrupted. Air travel has been disrupted.
Oh, I see.
Healthcare workers have been jettisoned to fight coronavirus. And so some of these other vaccines have fallen by the wayside. But it's very important, and they do caution, like, if you're a parent, do not skip that vaccination schedule. That's really important. That's protecting, obviously that's protecting you from a lot of mortality.
Exactly. And the doctors would tell you that too, right?
Doctors have told us that,
all part of the, the way to protect your kids, and even during this weird year, you got to keep that schedule going.
Yes.
So, interesting.
Yeah.
Okay.
So hopefully that infrastructure is not, jacked up too much for too long.
Right. So. Let's hope not. Yeah. Well, and again, when the COVID-19 vaccine comes out, they're going to want to get that distributed quickly across the country, as I would think that they would. And so, they'll need to have that in place. And I know a lot of states are talking about how to do that when the time comes. So we will wait and see what happens. But we'll certainly let everyone know what we hear. So great.
Cool.
Well, thank you. Thank you for sharing that research. I appreciate you doing that part of the job.
Thank you.
So I can do this part of the job.
Exactly. It's there's equal importance.
That's right.
Yes.
Distribution of power.
Distribution of labor.
Checks and balances.
Checks and balances.
There you go. So perfect. Cool. All right, everybody. Well, we appreciate everyone watching and tuning in today. Lots of good information, as always, from our guests, which we appreciate, and from Megan, which we appreciate. And so we will be back on Thursday. And I think the plan is to talk to maybe a mental health professional.
Yes.
Yeah. A little bit about that, because we know a lot of folks struggling. And so we'll be back on Thursday with a lot more information. So have a great week, everyone. We'll see you Thursday on KSJE. Bye-bye.